Hydrocodone Bitartrate Er 120 mg tablet is a medication used to help relieve severe ongoing pain. It belongs to a class of drugs known as opioid analgesics, which work in the brain to change how your body feels and responds to pain. It is important to note that the extended-release form of hydrocodone should not be used to relieve mild pain or pain that will go away in a few days. This medication is not for occasional, as needed, use. When taking this medication, it is important to follow the prescribed dosage and timing recommended by your healthcare provider. It is typically taken once a day, at the same time each day, with or without food. The dosage may be adjusted by your doctor based on your individual needs and response to the medication. The benefit of using Hydrocodone Bitartrate Er 120 mg tablet is the extended-release formula, which provides 24-hour pain relief. This can help improve your quality of life by allowing you to manage your pain more effectively throughout the day. It is important to take this medication exactly as prescribed to maximize its effectiveness and minimize the risk of side effects. It is important to discuss any concerns or questions you have about this medication with your healthcare provider to ensure you are using it safely and effectively. Before taking hydrocodone, make sure to read the medication guide provided by your pharmacist and ask your doctor or pharmacist if you have any questions. Take this medication by mouth as directed by your doctor, usually once daily. Do not pre-soak, lick, or otherwise with the tablet before placing it in your mouth, and swallow the tablets whole. Do not crush or chew the tablets as it can release all of the drug at once, increasing the risk of side effects. You may take this drug with or without food. If you have nausea, it may help to take this drug with food. The dosage is based on your medical condition and response to treatment. Do not increase your dose or use this drug more often or for longer than prescribed. Pain medications work best if they are used as the first signs of pain occur. Before starting this medication, ask your doctor or pharmacist if you should stop or change how you use your other opioid medications. Suddenly stopping this medication may cause withdrawal, especially if you have used it for a long time or in high doses. When this medication is used for a long time, it may not work as well. Though it helps many people, this medication may sometimes cause addiction. Tell your doctor if your pain does not get better or if it gets worse. Some common side effects of Hydrocodone Bitartrate Er 120 mg tablet may include nausea, vomiting, constipation, lightheadedness, dizziness, or drowsiness. These side effects may lessen over time. To help prevent constipation, it's important to eat a high-fiber diet, drink plenty of water, and exercise regularly. You may also need to take a laxative. Ask your pharmacist for recommendations. To reduce the risk of dizziness and lightheadedness, make sure to get up slowly when standing from a sitting or lying position. It's important to remember that this medication has been prescribed to you because the benefits outweigh the risks of side effects. Most people using this medication do not experience serious side effects. However, it's important to contact your doctor if you experience any serious side effects such as interrupted breathing during sleep, mental or mood changes, stomach or abdominal pain, difficulty urinating, or signs of adrenal gland issues. In rare cases, a serious allergic reaction may occur. Seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you notice any other effects not listed here, be sure to contact your doctor or pharmacist. Hydrocodone has a high risk of abuse and addiction, which can lead to overdose and death. It may also cause severe breathing problems. To lower your risk, your doctor should prescribe the smallest effective dose for the shortest possible time. Ask your doctor or pharmacist about having naloxone available to treat opioid overdose, and make sure your family knows the signs of an overdose and how to treat it. The risk of severe breathing problems is higher when starting this medication, after a dose increase, or if you take the wrong dose or strength. Taking hydrocodone with alcohol or other drugs that cause drowsiness or breathing problems can have very serious side effects, including death. Other medications can also affect how hydrocodone works, so be sure to ask your doctor about drug interactions. Seek medical help right away if you experience slow or shallow breathing, severe drowsiness, or difficulty waking up. Do not crush, chew, or dissolve this medication, as it could cause a fatal overdose. Women of childbearing age should talk to their doctor about the risks and benefits of using this medication, and tell their doctor if they are pregnant or plan to become pregnant. Using hydrocodone during pregnancy may slightly increase the risk of birth defects if used during the first 2 months, and using it in high doses near the expected delivery date can harm the unborn baby. Babies born to mothers who use this drug for a long time may develop severe withdrawal symptoms, so it's important to tell the doctor if you notice any symptoms in your newborn baby. Keep this medicine in a safe place to prevent theft, misuse, or abuse, and seek medical help if someone accidentally swallows this drug. Before taking hydrocodone, it's important to let your doctor or pharmacist know if you are allergic to it or other opioids, or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have brain disorders, breathing problems, gallbladder, kidney, or liver disease, mental/mood disorders, a history of substance use disorder, stomach/intestinal problems, pancreatitis, difficulty urinating, or trouble swallowing. Hydrocodone may affect the heart rhythm, so it's important to let your doctor know about any heart problems, family history of heart problems, or if you have low levels of potassium or magnesium in your blood. Certain medications or medical conditions can increase the risk of heart rhythm issues, so be sure to discuss this with your doctor. This medication may cause dizziness or drowsiness, and it's important to avoid alcohol or marijuana as they can increase these effects. It's also important to let your doctor know about all the products you use before having surgery. Children and older adults may be more sensitive to the side effects of this drug, and during pregnancy, it should only be used when clearly needed. It can also pass into breast milk and may have undesirable effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking Hydrocodone Bitartrate Er 120 mg tablet. Always keep a list of all the products you use and share it with your doctor and pharmacist. Certain pain medications, naltrexone, and other medications can interact with hydrocodone, affecting how it works in your body. Additionally, combining this medication with other products that may cause drowsiness or breathing problems can increase the risk of serious side effects. It's crucial to inform your doctor or pharmacist of any other medications or substances you are taking. Furthermore, hydrocodone may interfere with certain lab tests, so it's essential to let lab personnel and all your doctors know that you are taking this medication. Always consult with your healthcare provider before making any changes to your medication regimen. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek emergency medical assistance immediately. In the United States, you can call 911 for help. If the person is conscious and not showing any symptoms, it's still important to contact a poison control center right away. U.S. residents can reach out to their local poison control center at 1-800-222-1222. In Canada, residents should call a provincial poison control center for assistance. Symptoms of overdose may include slow breathing, a decreased heart rate, or loss of consciousness. It is important not to share this medication with others as it is against the law. This medication has been prescribed specifically for your current condition, so it should not be used later for another condition unless directed by your doctor. In that case, a different medication may be necessary. If you forget to take a dose, just wait until your next scheduled dose. Don't take extra to make up for the missed dose. When storing Hydrocodone Bitartrate Er 120 mg tablet, make sure to keep it at room temperature away from light and moisture. It's important to avoid storing it in the bathroom and to keep it out of reach of children and pets. When it comes to disposing of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product and it is expired or no longer needed. You can find more details in the medication guide, or consult your pharmacist or local waste disposal company for further guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.